My name is Dr. Hein. I'm an Atlantic Fellow for Health Equity, a nurse, and an Associate Professor of Nursing. Today I'm going to talk about medical legal transition in the South during COVID under President Trump. Risk, authenticity, and hope. Several years ago, my discomfort in my own skin grew to an intolerable level, and I began to realize I was transgender. This did not come out of the blue. It was a progression of self-insight over time. You need to consider the context. The southern U.S., particularly under President Trump, is non-accepting of trans people. His administration has rescinded legal protections under Titles 7 and 9 of the Civil Rights Act, has withdrawn protection of trans homeless people in shelters, and reinstated the trans military ban. Being trans is risky right now, more so in the conservative South. But there's also a cost when you're not true to yourself. Anxiety, depression, and suicide are not uncommon in the trans population. To medically and legally transition in a southern state, such as South Carolina, is long and complicated. It typically involves over a year of counseling, months to years of hormone therapy, then irreversible gender surgery. Not all states require surgery for gender marker change, but South Carolina does. There are very few surgeons in state offering this service, and many insurance policies, including the state employee policy of South Carolina, explicitly exclude these surgeries from coverage. Scheduling these surgeries can take months and sometimes years, even longer during COVID. And then, of course, there's the fear of contracting COVID through doctor's visits or surgery itself. After all that, you procure affidavits and petition the court to legally change your name and gender marker. Your petition can be bounced back by a clerk who's ignorant of trans health and effectively denied. We don't offer that service. Back to the court with an attorney this time, and you're granted that order. Your next step is Social Security, the feds, but remember this is during COVID, and what you need, a name and gender marker change in their records, requires a face-to-face meeting because you need to show original documents. If you can get an appointment, it's another month at least. Then to DMV and HR at work, and only then can you change the name on your work email account. This whole time you've been transitioning, you're being outed by every email you send to students, staff, faculty, and stakeholders you interact with, dozens of times a day. Because HR won't change the name of married or divorced people in the email system without a Social Security change, it's considered fair. Each step in this process requires perseverance, a thick skin, and hope. Hope that your career can withstand this, and hope that someday these barriers to just being you will decrease for the next guy. I hope for our future under a new presidential administration, and that the legal walls they've erected to trans equity are pulled down, and living authentically gets a little more easy. Thank you for listening.